webinar. And I'd like to have our beloved university for continuously supporting educational activities, and a special thanks to the organizing committee. So my name is Tuqa Alsinan. Inshallah, today I'll be talking about the pediatric surgery matching system. I have nothing to disclose. So outline of this presentation, first we'll be discussing the Saudi Commission for Health matching system, and then a brief information about the pediatric surgery program here in Saudi Arabia, and then some clinical rotations that will benefit some medical students and interns, inshallah. How to format your CV, and some interview tips. Feel free to stop me after each section and ask a question. So, starting with pediatric surgery. Pediatric surgery is a specialized branch of the general surgery, as we all know. It's dedicated to the care of infants, children, and adults. Here in Saudi Arabia, it's up to the age of 14-year-olds. In the US, it's up to 18. So it depends on the system. Children have unique anatomical, physiological, and psychological aspects. So we have to understand them from these different points of view. Mainly in pediatric surgery, we treat congenital anomalies, tumors, trauma, emergency, some elective cases like hernia, and some neurological disorders. Like any other surgical specialty, it's a multidisciplinary team approach, including neonatologists, pediatricians, anesthesiologists, radiologists, and some oncologists. We all know that any care in medicine is patient-centered care, but in pediatrics, it's a family-centered care. Also, a unique thing or a special thing about this field, it's an ongoing and active research field where we encounter unique or rare anomalies every now and then. So the Saudi matching system. Yearly, the Saudi matching system, they download their yearly timeline. So this is the timeline of last year, which will be hosting now. It's hosting now. They make it very clear, starting with the opening of the application, when the application will be closed, when the grades will be announced, when the interview will be there, how the interview and how each candidate will be interviewed in each hospital. It's a very well organized outline that everyone is following here for all specialties.
دكتورة، في مجال بس لو فينك بس توضحي الصوت شوي، لأنه يمكن الصوت شوي مو واضح. بس
الحين أوضح؟
هو
أوضح
طالع
الحين؟
شوي في تغبيش شوي بس.
طيب الحين؟
أيوة الحين واضح.
Okay. So we have the cumulative grade. We call it المركبة. First, it's composed of the Saudi licensing exam, the SMLE exam, which is 50%, which is 55%. Sorry, it was 50. Now it became 55% of the grade, and CV contain only 15%. However, your cumulative GPA from the university is 30%. I attached a special calculator to calculate your المركبة, which you will put your SMLE grade, CV, and cumulative GPA. What we do, we usually put our CV, our GPA, and we put the point that we can gain from our CV, our expected or our aim from each exam. So each exam we enter, we will be having an aim. Like for example, I want to score above 80, above 85, so on. And you will know how your المركبة will be for the matching system for the year after. طبعا we have to be yearly updated about the system because it keeps changing. Sometimes it's minimal change, but it's massive. So last year there was some changes. المركبة, for example, for SMLE it was 50%. Now it became 55%. As you can see here in the black and the red circle. However, in the CV, all of us were creating or we're formatting our CV to represent us. But sometimes we create our CV to gain points to enroll us in the matching system. So the Saudi Commission, they have special points for each CV. If you have those points, you will gain the grade in the matching system. For example, I have 5 research publications. None of them accepted in the matching system. However, my colleague have only one research paper and it's accepted, and he will gain the point, or she will gain the point. So we have to play it smart, as we can say. For example, we have to have at least 2 research, one published in well-known journal to the Saudi Commission. They accept any Saudi journal, and they accept some journals that index in the PubMed or Midline. They have a special criteria. You can check it out in their website. But to be in the safe side, just have a publication in any Saudi journal and you'll be safe, inshallah. Also, some well-known journals like Curious, American Journal of Case Reports, all of these are accepted. The other point, unfortunately, it was removed, that if you have any not yet published research, you can gain some points, but now it was removed. Second, you have to gain some point of your interest. Also, unfortunately, this was removed. That you have to put, like, for example, pediatric surgery, they have only 2 places to match in Saudi Arabia. You have to put Riyadh and you have to put Jeddah, and after that you will gain some points. Last year it was removed. This year it was removed. We were aiming that they will include it next year. So just pay attention to it. This you will add it just by enrolling into the application system when it is open. After that, there are some points that not all interns can gain, like any service job. You can gain it after you finish your internship and you have a service job, then you can gain these points. What else here we have? Oh, for the volunteering campaign, you can gain up to 5 points if you are volunteering in any campaign, in any malls, universities. But again, your certificate, sorry. Can you hear me, or you can see the screen or no?
Yes, doctor, we can hear you and see the screen.
Sorry for this.
No problem.
Okay, regarding the campaign, any campaign in any malls or in any university is accepted, but your certificate has to match their criteria. So the certificate, it has to have your full name, the name of the event, the date of the event, and the place of the event. Is it in mall or in where so and so? And it has to be stamped and signed by the director of that event. Some of my colleagues, their certificates were rejected just because the dates were not opened or small things was not included in that certificate. So again, you have to play it smart to gain some points of the CV and to match the criteria of the Saudi Commission, inshallah. And yearly, it will be updated. Yearly, there will be ongoing webinars for such things. You will find it in Twitter, Facebook, Telegram, so and so. People are arranging such things to guide you through it, inshallah.
دكتورة، في شوي صدى في
Yes.
الصوت، لو في مجال بس تعدلي بعد منك.
Now better?
توقع إيه.
Okay. I'll try to raise my voice so it will be clear, inshallah. So, training the program. Let's take a little review or a little information about the pediatric surgery training program here in Saudi Arabia. So it's a joint program. So you don't rotate only in one hospital. You have to rotate in several hospitals. And it was established in 2016. So it is a newly established program and ongoing and newly developed. It's a total of 6 years of program. After finishing your medical school or your service job after your internship, it's a highly competitive acceptance among the top 5 in Saudi Commission program system. Each center is accredited to accept only 1 resident every other year. So let's explain this. We have the Prince Sultan Military Medical City and King Faisal Specialist Hospital. Let's say, for example, they open seats this year. Each hospital will accept only 1 resident per year. And the year after, KSH and TSMNT, they will not open a seat. Another hospital will open, like Al-Haras Al-Watani, National Guard Hospital, and that's King Fahd Medical City. Again, each hospital will accept only one resident. So I hope it's clear. So total each year, only 4 or 5 hospitals will open, and only 4 or 5 residents will be accepted each in each hospital. Sorry for that. So this is the master rota. Master rota, every year, it will be downloaded and sent by the Saudi Commission of Health Specialty to distribute the residents. And they have a fixed rota that each resident has to follow. So it's a 6-year program. The first year, 3 months, 16 weeks. They go by weeks, not by months. So 16 weeks composed of pediatric surgery, purely pediatric surgery in your sponsored hospital. Let's say you are accepted in King Faisal Specialist Hospital. You will be doing 6 weeks of pediatric surgery there. After finishing that, you will be rotating on general surgery for the next 24 weeks. And then 2 months or 8 weeks only for pediatric ER. And each year you will be having a 4-week leave. This leave, it's not a block. You can divide these weeks the way you want. Like you want starting with your residency first, only 1 week or 5 days, whatever. It depends on you and how you arrange it with your program director. R2, you will be having 12 weeks of pediatric surgery, 8 weeks of hepatobiliary, this is for adults, and 8 weeks of cardiothoracic or thoracic only, mainly thoracic surgery, adults again, and 1 month of vascular surgery, adults. And then you'll be moving on to pediatric again, 6 weeks of PICU rotation, 6 weeks of NICU rotation, and 4 weeks of research. This week of research, they encourage residents to enroll in research course in National Guard Hospital that's accredited by the Saudi Commission of Health Specialty. And by the end of your whole residency program, the 6-year program, you are expected to have 1 publication of pediatric surgery. And they're providing you with such time to organizing your thoughts, creating your research questions, starting to collect your data, and so on. And you will be having them in. And again, at the end, you have your 4-week leave. Being an R3, you have 12 weeks of pediatric urology, 36 weeks of pediatric surgery, and again, your leave. R4, you will be having a 36 weeks of pediatric surgery and 8 weeks of electives. Electives, you can do whatever electives you want. You want pathology, radiology. You want to organize with your director and your sponsoring hospital to go for elective abroad. It depends on your arrangement and how you organize or how you invest these 2 weeks. And then you will be having again your 4 weeks research. So they are expecting a more progress. If you're being an R2 and you have established your research question and you collect your data, being an R4, you're expected to have your results, like your discussion and the major progress. They're following up with you and you end with your mentor, the research copy. And at the end, you have your own. Being an R5 and R6, you are purely pediatric surgery the whole year, including your leave. طبعا starting from R3 till R6, the Saudi Commission, they distribute the residents based on the needs for each hospital. And they mainly divide 1 senior and 1 junior per hospital. So there will not be overlap between juniors nor seniors. So for example, next year being an R3, no one knows in which hospital they will rotate. After finishing each year, they send the rota with each name and each hospital they will rotate in. I hope the master rota is clear, because by understanding the master rota, I believe you will understand the pediatric surgery here in Saudi Arabia, inshallah. Okay, clinical rotation. Inshallah, this one will benefit you if you are preparing for pediatric surgery clinical rotations, either during your medical school, between your fellowship years, or during your internship. So here in Saudi Arabia, it's divided into two sectors. The first sector is in Riyadh, it's in the central region. They have up to 7 centers with Department of Pediatric Surgery. Starting with the biggest one, King Abdullah Specialized Children's Hospital. This is National Guard Hospital. Second is King Faisal Specialist Hospital, KSA. Third one is King Khalid University Hospital. This is King Saud University Hospital. Fourth one is King Fahd Medical City. Fifth one is King Saud Medical Complex. This is Shimeti. And sixth one is the Prince Sultan Military Medical City. And the seventh one is Security Forces Hospital. While the second sector, basically it's المنطقة الغربية. So Eastern region, they have King Abdulaziz Medical City, their National Guard Hospital, King Saud, Science Hospital, University, and King Abdulaziz University. King Faisal, also they have another branch of KSH there. They have King Fahd Armed Forces Hospital, Maternity Children Hospital in Mecca, Al Medina, and Abha. All of these hospitals, they have Department of Pediatric Surgery. So if you want to rotate in any of these hospitals, you can basically contact the secretary or the chief resident there or the program director there via email that you are willing and eager to rotate in pediatric surgery to gain more knowledge and surgical experience in their hospital. And they will guide you, inshallah, through the process. It will be easy process, especially for observing or learning or taking more exposure. It will be easy procedure, inshallah. But because each hospital have a special way of contacting and communicating, and to make it brief for you. Let's move on to formatting and creating your CV. So CV, I will just define it the way I usually like to define it. CV, it's a paper filled of information, your personal achievements that's basically introducing you to others. So the way you format, the way you put your information in the CV, it is representing you. Maybe the way I format my things, it does not represent you. So just enjoy it, do it with passion, do it with love, and create your own CV the way you want. There is no rule of putting your name in the right side or left side, just to create your own the way you want. And make it brief, clean, simple, and a professional way. Have a consistent color and theme. Use bullet points or concise phrases to convey your information. Don't put a lot of information, like you have a publication about oncology projects in the US. Don't put a lot of information that you did, you were participated, you did data collection, you did blah, blah, blah. Don't put too much information. Just put published, the title, the location, that's it. Leave the detailed information to be asked while you're being interviewed. Limit the amount of text to ensure readability and prevent information overload, as we just discussed. And take feedback from your seniors and your colleagues. So you create or you formatted your own CV. Just ask your colleagues next to your colleagues or anyone of your friends. Just ask them politely, take a look. Do you think it's nice? Who do you think I should correct? Again, show it another friend, show it your father, your mother, your seniors, anyone. Each one will give you a small feedback, and feedback after feedback, it will improve your CV. And for medical students, try to create your own CV from now. Even if you have some achievements or you're aiming for more and more achievements, and inshallah you would win, all of you would win. Just start creating it from now and build your achievements based on that. So you will see your own progress. I usually like to use Canva. It's very easy and free, and it has a lot of formats, colors, themes. So enjoy while creating your CV. Also, it has some examples, so you can take some opinions from other people's CV. Okay, so creating an effective CV will help matching in your residency application or showing your interest if you are medical student or intern. It shows your qualification and makes a strong impression. So CV structure. As I said, you can create your own CV the way you want, but there are some categories or hit section that it has to be there. Everyone is expecting to see these information on any CV, nationally and internationally. Starting with the introduction. Introduction, I don't mean like writing sentences or paragraphs. It's just a brief information at the beginning. Your name, your title, like medical student, medical intern, and your contact information, your phone number or your email, and some people like to add their picture. This is considered an introduction. If you want to write a few sentences, it's up to you. Second, in 2016, and yeah, brief information about your education. But everyone wants to know from where you graduated, what rotation you did. Sorry, not sorry, the place your service job was there, if you did service or anything. And then your clinical experience. Clinical experience basically is your rotations in your clerkship years, either in summer, here, nationally or internationally, or any rotation you did related to pediatric surgery during your internship year. People will be interested to see how eager and interested you are to join their program. So if you say you did summer rotation while your medical school in King Fahd Medical City Department of Pediatric Surgery, and during your internship you did pediatric surgery in KSA and Security Forces Hospital, and now you are a service resident in the Prince Sultan Military Medical City. You are strongly you are strongly letting them know you are strongly, or you are showing, emphasizing your interest in this field. After that, an important section also about your research and publication. This is a very important one, and I highly encourage all medical students and interns to keep joining and participating in research projects. You can write the title of your research, the year it was published or conducted, or if it's still, even if it's still ongoing, you can join it, and the name of the journal if it was published, and that's it. No need for extra information, because people in interview, they will automatically say, oh wow, mashallah, you did an oncology project in the US. Can you please tell us more about it? So if you are filling them or feeding them the information, they will ask things that you're not expected, but I'd say you're not, maybe things wasn't in your mind. You will be shown like you don't know much about your project, and you don't want that such questions. So leave a window for a question. After that, awards and honors. It depends. This is not, it's an optional thing actually. But if you were a dean listed student, if you won an award in any conference or research day, you can join it there. It's nice. Membership also, it's not, it's an optional one, but it's nice to have some membership information, like you are a member in surgery interest group, or you are a member in Saudi council, stuff like that. Skills and interests. Again, it's optional. For me, I don't like adding skills and interests. It's a window. They will ask you automatically, what do you like to do in your free time? And if you write, for example, I like horse ride, for example, they will ask you detailed questions about that horse ride. I know you know, because you will ask stuff that you really are skilled of, mashallah. But don't lead them in your interview to ask you questions that's not related to your main aim, which is joining pediatric surgery program. At the end, we have the references. References is very important section. References, it means recommendation letter. There is a difference, and we'll take some information about it. But there is a minor difference. It's not that important. But a reference, it's like you're asking the doctor or a consultant verbally, doctor, I worked with you throughout this rotation, and I gained a lot of information. Do you mind if I add your name as a reference in my CV? Maybe he will say yes. If he say yes, he will add his email or his phone number. That's it. No need for a recommendation letter. And it's very easy for the people who will scan or read your CV, because they will see the number and they will automatically just call. Fulan Fulani, he worked with you last summer on September. How was he? Was he a team player? Was he interested? And stuff like that. While the recommendation letter, it's a whole letter, written letter, that student A worked with us throughout this rotation. He covered on-call, he attended surgeries, participated some hands-on in the ward, and we recommend this. And it doesn't have that you add their name or phone number, because you already have a list. So for me, I recommend to have at least 2 to 3 only recommendation letters. After that, just to try to gather as much references as you can, because it's easier for you and for the consultant. And it doesn't make really difference here. Basically, people who really care about the recommendation letter, people who are willing to join fellowship programs abroad. Because in fellowship, they will accept people from different countries, and they literally want to know what they did during their residency. So it will be described in detail. He can perform such a procedure from A to Z and so on. So, but for our level or junior level base, it's not that important. It's nice to have one, but it's not that very important like a reference letter. I hope the section are clear for the CV. Feel free to highlight any point you have or any information. We can answer it after the lecture, inshallah. So moving on to our last section, which is interview. Any matching system has an interview. Interview defined as getting to know each other. So you want people to get to know you. So again, you are representing yourself by preparing your CV and preparing the way you look and the way you talk, the way you answer, the way you smile, the way you greet people when you enter. So just be yourself. It's a pleasant experience that you will never forget. So pre-interview preparation, practice, and again, practice. Try to join try to research or ask more about the program you are willing to enroll in, and review your application. It's like an OSCE. Keep practicing with your colleagues will make you look more confident when you enter the station. For example, you want to enroll in King Fahd Medical City, you have to review their pros and cons, their cases, the way they handle pediatric cases, because it's tertiary hospital, as we all know, do they receive trauma cases, so and so. You will look more educated about the program you want when they start to ask you questions like, have you heard about our program? What do you know about our program? So prepare for such questions. Last one is be professional and respectful. Approach questions effectively. When they ask you questions, take a deep breath, take a few minutes back, and then answer them in a nice way. Be structured responses. Like when they ask, what do you know about our program in King Fahd Medical City? Don't directly say, you don't have trauma, you are tertiary, no. Just be nice, calm, and say, actually, I heard a lot about this center. It's one of the top hospitals here in the kingdom, and specifically in Riyadh. It's a tertiary center. It's under the Ministry of Health. I also heard that you have so and so. So give them a brief information that you are knowing the information in a calm way. Be short, straightforward, and clear when you answer the question. Be confident. Show a genuine interest and fit into the program, and emphasize your professionalism and etiquette when answering a question or in entering any interview. After that, the general look. General look, be formal, be confident, and dress well. Here in Saudi Arabia, for males, they usually like to have males either wearing a lab coat, soap, or any suit and any formal outfit. Don't wear jeans, don't wear shirts or any informal things. For females, they like lab coat or professional abaya. I think we're reaching the end of our lecture. For any more information about surgery or pediatric surgery program, feel free to contact the organizing committee of Surgery of Interest Group. Also, we have the Pediatric Surgery Interest Group. You can visit our Twitter, reach us via our email or Telegram for more information about the pediatric surgery program. And we wish you all the best. And inshallah, soon we hear more about you and see you between us in the program, inshallah. Before we close, if you have any pediatric surgery related achievements, if you have any publication, joined any special events or courses that you are proud of, please scan the code and share with us your achievements, and we will be more than happy to share it with others and to represent our country with such achievements. Thank you so much. I hope you enjoyed and benefited from the lecture. I'm more than happy to answer your questions.
Thank you so much دكتور تقى يعطيك العافية.
الله يعافيك.
If you guys have any question, you can just type it in the chat, or if you want to unmute and ask the doctor, feel free to do so.